My fellow Richmonders, the impact of COVID-19 on all of our lives has been significant and in some cases devastating. My thoughts are with those who are sick and to those who have lost loved ones during this pandemic. And my gratitude is with the healthcare workers who have been a source of comfort and care for so many Richmonders. I'm also thankful to all essential workers, including our essential city personnel, who continue to work hard so our residents can receive the services they expect. We're each other's keeper now, more than ever. So thank you for doing your part. Now, about a month into this crisis, we have a clear idea of what the pandemic's impact on our economy will be. COVID-19 has not only had a significant impact on our fiscal year 2020 budget, but also on the projected revenue upon which we based the fiscal year 2021 budget, which was submitted to City Council on March 6. Before the pandemic, we projected a fiscal year 2020 revenue surplus. That surplus has now been wiped out. To offset a budget shortfall, the city has implemented cost-saving measures across the board, including a moratorium on all discretionary spending and a hiring freeze. Even with these cost-saving measures, we are expecting to run a deficit this year and will likely have to tap into our city's rainy day fund to balance the fiscal year 2020 budget. On March 6th, I presented a values-based budget for fiscal year 2021 to not only better address core needs like schools, streets, and housing, but also to fund priorities that will build a more equitable and inclusive city that works for all of our residents. It was not easy to make significant cuts to this budget, but I am proud of the collaboration between the budget department and city council staff in crafting a revised fiscal year 2021 budget. The budget amendments we are proposing for fiscal year 2021 are based on the need to balance a decrease of $38.5 million in projected revenues. These changes are unfortunate, but necessary to respond to the changing circumstances we find ourselves in. In broad terms, this means we will be unable to fund most of the new programs that we wanted to launch, and most existing programs will see no funding increases over the fiscal year 2020 allocations. Virtually all city departments will see deep cuts to their operating budgets, and we will be unable to afford the step and salary increases we plan to give to employees, including to our public safety personnel. Additionally, we decided not to include utility rate increases in the coming year. In order to make up the $2.5 million cost difference, we will make further cuts to department budgets. Amidst all the cuts and sacrifices, we remain committed to level funding for our core priorities: the future of our children, the stability of our most vulnerable communities, and the infrastructure of our neighborhoods and transit system. That is why the revised fiscal year 2021 budget will allocate more to RPS than in fiscal year 2020, following council-approved guidance to dedicate a certain percentage of real estate taxes to schools, and why the Affordable Housing Trust Fund and Eviction Diversion Program will continue to be funded at fiscal year 2020 levels. We also work to ensure that many nonprofits for which we partner with to provide critical services like after-school programs and serving the homeless did not see reductions below their fiscal year 2020 levels. Ladies and gentlemen, this international crisis is forcing local governments everywhere to make tough, sometimes heartbreaking decisions when it comes to their budgets. And Richmond is no exception. But I'm thankful to be blessed by an administration, members of council, and a community that I believe can unify around our shared values of equity, service, opportunity, and fiscal responsibility. We look forward to submitting our formalized amendments to council by April 20th and making them available and accessible to all of our residents. And we look forward to working together with the council to make the best of a bad situation. In the meantime, please, again, I ask you take care of yourselves, your loved ones, and the rest of our community. We are all safer and stronger at home. Thank you.